Hi, it's Nicole from 92.5 XTU, and I am very excited to welcome the amazing Dr. Timmerman, breast surgeon, Penn Medicine, Virtua Healthcare Cancer Program, located in South Jersey with offices in Morristown, Voorhees, and Washington Township. Obviously, this is very important. October is right around the corner, Breast Cancer Awareness Month. It's your time to shine like you don't already do it 365 days. But obviously it's very important to talk about it even now more than ever, right? And so let's just first tell me how you're doing. How you having a good day? How's your day?
Day is great. Always good. I have lots of wonderful patients I got to see today. So yes, everything is good.
Awesome. So let's just jump right into it. What are the warning signs or symptoms of breast cancer?
Sometimes there's no symptoms at all, which is why mammograms and breast imaging are really important.
Yeah.
But commonly, we should be checking our breast monthly, looking for changes and signs, which would include like a breast mass, skin changes or thickening, inversion of your nipple discharge, just those types of things that, if you say, okay, it wasn't here before, why is it there now? So if you do check every month, which is what we would recommend, we want you to look for these types of changes and then bring it to the attention of your doctor.
And I think it's so important, especially for women, because women were always like, oh, like your body, like, don't look at it, don't touch it. It's like, no, you need to touch your boobs. You need to know what they look like. You need to touch them. You need to feel yourself up. That is crucial.
It is, yes, you need to know, and you need to know what your normal is, and then you need to know when that changes or if it changes.
Yeah. Absolutely. So who should get a mammogram and when? Obviously, the benchmark has been 40. If after 40, should you get one every year? Could people get them before 40? Obviously, insurance comes into play, but I think it's important maybe when you talk about risk factors or if it runs in the family, can you just speak a little bit about that?
Sure. So yes, definitely age 40 and on, you should be getting a mammogram and a mammogram every year. Now, sometimes there are occasions where we get mammograms earlier. So if you are having a problem or you notice a change, your doctor may order a mammogram or an ultrasound. And then with family history, if you have a first degree relative, which would be like your mother or your sister, if they had cancer at an early age, you want to do 10 years prior to their diagnosis. So if they were diagnosed at like age 45, you might want to start your mammograms at age 35.
That's
just to
really
make sure you get that
good
extra screening in there.
Yeah. I don't think a lot of women know that. And it's important for men who are going to watch this too, right? Because breast cancer does happen in men, and men should also care about their loved ones, whether it's their mother or their aunt or their sister or their wife or their daughter. So it's important for them to be aware of what's going on too.
Exactly. Yes.
So if you've been told that you have dense breasts, should you ask for a different test?
Sometimes you can. So on the bottom of your mammogram report, it will usually give you a breast density category, and it goes from A to D. A meaning you're not dense at all, to D meaning you're extremely dense. In those patients, sometimes it is indicated to get a breast ultrasound. That's sometimes up to the discretion of your doctor, and sometimes it's based on your family history or other things that are going on with you. But on some patients, we do recommend that you get an ultrasound to look at those breasts a little bit more carefully if they are extremely dense.
Yeah, absolutely. And again, we talked about in the beginning of this self-exams and how they're so important. And once a month, obviously people get majority of women get mammograms once a year, but once a month you should be doing self-checks. In fact, I know a lot of people who found abnormalities because they did their self-breast exams.
Exactly. Yes. And I would recommend you do it maybe the week after your menstrual cycle as well, because you're a little less tender then, a little less nodular then, because your hormones are different at that time. So it's easier to do an exam that week following your menstrual cycle. And then it keeps you sort of on track of doing it monthly. You say, okay, I got my period last week. This is time to check my breast and, be sure.
Yeah, that's so good to know. So at Virtua, breast surgeons are part of Penn Medicine, and it's the Virtua Health Cancer Program. And
Correct.
Can you just speak a little bit about that partnership and how you are still located in South Jersey in Voorhees, Morristown, and Washington Township?
Yeah, so we are a whole comprehensive cancer program, meaning that we have surgeons, we have oncologists, radiation oncologists, geneticists, plastic surgeons, the whole team, and we work together on all patients, with with a cancer diagnosis. So what happens is it's not a one-dimensional diagnosis, right? I can't just say, oh, it's just surgery only. It comes with the whole team. So you need to look at it from the medical oncology perspective, the radiation oncology perspective. And if you need plastics and reconstruction afterwards, or during your care, we usually work at the same time, they're available as well. And patients with a new diagnosis are brought up at a cancer conference. The whole team meets every week, and we relook at all your breast imaging, all your breast pathology, and the whole team is there to make sure that we are all in agreement with the plan. There's no trials that these patients fit into, that are missed. We have, our research team is there, and we all discuss the case so that everybody's on the same page, and we have a really good, strong treatment plan for each individual patient.
Yeah, and obviously the diagnosis is overwhelming when you first hear about it. So the fact that you have a place to go and you have all these amazing, not only intelligent doctors and nurses, but also caring. So you're able, and a lot of people don't realize that you have the oncology part, like the genetics part, you have the reconstructive part, that all has to work together. And so the fact that that's all happening in the one spot is so very important. And it puts people at ease.
Yeah, well, I think it's important to know that we are all taking care of you, and we talk constantly. Our care team is always in communication with each other. And we also have an amazing nurse navigation team that reaches out to every patient, and they follow those patients from the diagnosis all the way through to survivorship. So
you took the words right out of my mouth. Yeah. So it's called nurse navigation, which I think is a lot of people don't know what that is.
So what happens is, if a patient's seen in my office and we discuss their diagnosis, I refer them right away to our navigation program. And those nurse navigators reach out to those patients. They watch their chart through their whole progression, and their whole treatment plan to make sure that they get wherever they need to be, because it is overwhelming, because it is a team. So I'm going to refer you to a lot of different doctors, and to make sure that you get all that done in a timely fashion. You get all your lab work, any repeat imaging. They watch your chart and make sure that you're up to date and you're getting where you need to be and nothing gets missed. They're also there for support as well, for any questions that you have, any additional resources that you might need. Because Virtua has a wide variety of resources and programs, whether it's like exercise programs, nutrition, but all that, is available. And the nurse navigators are a great resource to finding out those types of programs.
Absolutely. And when you have a question that you don't necessarily want to go online and you want to search the internet, or you want to go Google, like the fact that you have a real person that's a nurse in this field that could understand and then answer these really important and very personal questions is priceless.
Yeah, agreed. They do an amazing job.
Yeah. So if there's one piece of advice that you can give any woman or man or person who's watching this about breast care and breast cancer prevention, what would that be?
So back to our first point about really knowing your body and doing the self-checks is important. And then just your overall health and preventing breast cancer, diet and exercise play a huge role. And I know that people hear from, their primary care, everybody's telling you diet and exercise, but it is extremely important. So the food that we put into our body has an effect, right? So, you want to eat good, healthy things that have a good, healthy result on your overall health. And then exercise, staying active and doing exercise is a way to reduce your risk. And then also, if you're a breast cancer patient, it also reduces your risk of recurrence.
Awesome. Right. So get those mammograms scheduled, get those mammograms every year, make sure you're feeling yourself up, get to know your breasts. That's so important. And obviously go see our friends at Virtua, who are amazing. Dr. Timmerman, thank you so very much. For more information, to make an appointment with Dr. Timmerman or the team of breast cancer specialists at Penn Medicine Virtua Health Cancer Program in South Jersey, you could just go to virtua.org/mycancerteam. Thank you so much.
Great. Thank you. I appreciate it.